Okay, so welcome and thank you for joining us today for the meeting of the New York City Health and Hospitals Board of Directors. Today's meeting is officially called to order. So for the record, please note Erin Kelly is representing Deputy Mayor Ann Williams Ison. Dr. William Fisher is representing Deepa Abula, and Karen St. Hilaire is representing Molly Wasso Park, all in a voting capacity. Uh, During the executive session, the board received and approved oral and written governing body submissions from NYC, H&H Elmhurst, and Bellevue. The board received and approved semi-annual governing body report, recent submission from NYC Health and Hospitals Metropolitan, Henry J. Carter Specialty Hospital, and Henry J. Carter Nursing Facility. So next on the agenda is the adoption of the minutes for the Board of Directors meeting held on November 30th, 2023. Are there any questions or changes? Can I hear a motion to accept these minutes?
So moved.
All in favor, please say yes.
Yes.
Opposed, say no. So the minutes are adopted. So I'm gonna move now to the resolutions, and then we'll cover all the items in the agenda. So on number six in the agenda, it's approving the New York City Health and Hospitals Corporation Annual Board Committee assignments effective January 1st, 2024, as set forth in the attachment here to, as mandated by Article 6, Section 1C of the bylaws, and further authorizing as set forth in Article 5, Section 1, the vice chair shall be chosen by the board from among themselves and shall be elected annually. Approving the New York City Health and Hospitals Corporation to appoint Frida Wang as the vice chair of the board of directors. And this is being presented directly to the board today. Any questions or comments on that? Okay, so all in
Did
favor,
you say
please.
Frida Wang?
Well, you have it here, yeah, sorry, I wasn't looking at the screen. So all in favor, please say yes.
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 Opposed, say no. Thank you for your service, to all of you. So let me move to number 7, Ms. Wang.
Okay, authorizing the New York City Health and Hospitals Corporation, the system, to execute contracts with Cherokee Nation Management and Consulting, LLC, International Rescue Committee, Inc., Horn, LLP, Rapid Reliable Testing, New York, LLC, doing business as .go, Inc., and MedRight, LLC, doing business as MedRight Urgent Care for HERC Case Management Services at a not-to-exceed amount of $176,800,000 for a contract term of 1 year and 2 6-month renewal options exercisable at the discretion of the system. This was presented and discussed at the Finance Committee on December 4th, 2023, and approved to bring forward to the full board today.
All right. So to get started, we just have one slide to contextualize the 3 resolutions that we're going to be bringing forward today. So thank you for having us. So I wanted to talk about the 3 main ways that Health and Hospitals remains a very active and important part of the city's response to the asylum seekers that are still coming to us for help. The first way is that we operate currently 16 HERCs or humanitarian centers on behalf of the city. Currently, our census has over 23,000 asylum seekers across our 16 sites. The second way is that we operate the city's arrival center. As a quick reminder, all asylum seekers, whether you come from plane, train, automobile, or bus, all come through the same front door of the arrival center that I went through this morning. So this is a place where we can offer the same care to everybody when they arrive, which includes screening for communicable diseases, urgent care, universal screening for depression, vaccinations, things like that for children and their families. This is important because we've seen, unfortunately, the consequences of when this care is not provided to people in Texas before they're sent here. For example, we saw a child that had a seizure because his anti-epileptic medication was taken from him in Texas and he was not offered an alternative. We've seen a woman get off of a bus from Texas, active in labor, who'd been crammed in a bus from Texas for a matter of days. And she delivered a healthy baby with our help at one of our hospitals that day. So due to all of that, we want to make sure that we're giving all of this care to people up front at the arrival center. And then asylum seekers have the conversation with one of our caseworkers to plan what their exit strategy could look like to complete their journey as quickly as possible, with us as a city moving to heaven and earth to get them what they want effectively and quickly. Actually, the number here is a little bit higher. We have 79,000 asylum seekers here. It's now more than 85,000 asylum seekers have come through the same front door of the arrival center and received all of the care that I just referenced. That should be a national model. The third way that we're helping New York City now is through case management. And this pertains to one of the resolutions that we're going to be bringing forward. Case management you could think of is as a primary care doctor, I'm effectively doing case management for my patients. I'm diagnosing their issues. I'm their quarterback, and I can make referrals as needed. The case managers that we have at our sites that we're building out for the whole city, effectively the same type of thing, where we have a quarterback, the case manager, that is the connection point to resettlement options, the specific type of legal help that people might need, reconnecting with friends and family across the country, even getting certain trainings to get the type of job that they would want, or learning to speak English. It's the sort of the one-stop shop, if you will, the quarterback or the primary care doctor of taking the next step forward in your journey. In terms of finance, I wanted to share that for FY24, this is in the November plan, H&H received the following amounts. FY24, $2.17 billion. FY25, $2.82 billion. H&H incurred $429.3 million of HERC expenses in Q1 of 2024, of FY24 rather. And all the H&H, OMB has provided H&H with revenue through the HERC MOU with the Mayor's Office to cover committed expenses to date. With that, we'll go into our presentations, and we have 3 related resolutions for today.
Okay, so thank you. So we're going to start with casework, but each of the 3 that we're going to go through, there's a few sort of common principles that you're going to see throughout that I'll state at the beginning, so we don't need to repeat them each time. So what we're looking to do is move from emergency procurement into competitively bidding, and doing that for casework, exit planning, doing that for laundry, and doing that for catering. Under all 3 of these, there's no work guaranteed. What we're doing is sort of pre-qualifying these vendors, but there's no guarantee that any work will be assigned to any of them. All 3 of them that we're bringing forward here, all of the proposers that we're moving forward with have committed to meeting the MWBE targets that we set forth. All 3 of them are 12-month agreements with 2 6-month optional extensions. And all of the expenses under all 3 are covered by that MOU with City Hall that Dr. Long just mentioned. So for this first one on case management, we're currently providing some of this work to assist guests with court date, child care plans, work authorization connections. And what we're looking to do is expand and deepen our work for exit planning. Really help these guests be able to develop plans to be able to move on to the next chapter of their lives. This is going to be, as Dr. Long mentioned, a citywide effort. Currently, we're using DocGo and MedRight for this work. With DocGo, we've committed $2.1 million through November and paid out $0 for this body of work. And with MedRight, we've committed $596 through November and paid out $0. As we said, this is for competitive. We're seeking competitive bids, and it's covered under the MOU. For our minimum criteria, we're looking for 3 years in business, MWBE, and $3 million in annual revenue. You can see here the substantive criteria. Of note on this one is we were looking for capacity for national resettlement services. We really wanted to bring in folks that are national experts, and if they have resources that can help us leverage their national Rolodex of organizations that they might work with in other cities throughout the country, and if there's a guest of ours that wants to go to that city, this national organization would help make that connection to help successfully resettle that individual from New York City to Chicago or Boston or wherever that might be. And you see there the evaluation committee. For procurement, we moved through the CRC and the review process through September and October. And then in November, the scoring committee identified the top 5 scorers, which we're seeking to move forward with. You see here vendor performance, rapid reliable testing, DocGo, satisfactory to date. And the next incumbent here, MedRight, also satisfactory. For the vendor background, there's a couple new entities that we're working with here. Cherokee Nation Management and Consulting and International Rescue Committee. And what you see here is some of their expertise in terms of how we were looking for some of those national experts to bring those skills. Cherokee Nation Management and Consulting, you see here, their approach to their case management aligns with our strategy, which is we've identified households based on what sort of obstacles they have to move. Red, yellow, green. Red being those that we expect to have the highest obstacles, yellow in the middle, and green, those individuals or families that might be most ready to move on to the next chapter and not needing city-supported housing. So the Cherokee Nation Management Consulting, their strategy is very much in line with what we're looking for there. International Rescue Committee, this is a very well-known entity, nonprofit. One of the things that we're very excited about working with them is they bring deep, deep experience both regionally here, nationally, and internationally from around the world. And we're excited to move forward with IRC, hopefully. Horn LLP, they've worked with state and federal entities to provide national resettlement services to over 85,000 asylum seekers, and you can see some of the additional work that they've done in this space. As always, the work is assigned based on need, no work is guaranteed, and all of these agreements we can move away from any individual vendor, and we can terminate contracts with terms favorable to health and hospitals on short notice. Vendor diversity here, you see that the vendor diversity team set a goal of 35%. As I said at the beginning, each of them meet those needs, 35%, although IRC is a nonprofit exempt from that. So we're seeking here to move into contract with Cherokee Nation Management and Consulting, IRC, Horn, DocGo, and MedRight. Case management services with a not to exceed of $176.8 million. That NTE, that not to exceed, is based on the assumption that caseworkers will be available, will have coverage 16 hours a day, and seeking to meet with each family 3 times, or individual, 3 times per month during that first month during their stay with us, and then ongoing. The contract here would start in January with a term of 1 year, 2 6-month renewals, and as stated, everything is covered under the MOU. Thank you.
Thank you. Any questions from board members? I just have a quick comment, which is like, thank you for running this process. I mean, that started back in September, and it looked like you had a lot of interest from vendors too, as I was looking at the presentation there. So I'm glad to see that. Any questions or comments from board members? Okay, hearing none, then let me take it to a vote. All in favor, please say yes.
Yes.
Opposed, say no. Thank you. You have 2 more, right? So
Yes, 2 more. Which Ted and Chris have already alluded to. Number 8, authorizing the New York City Health and Hospitals Corporation, the system, to execute contracts with Rethink Food NYC Inc., LIC Com, LLC, doing business as Commissary, Bridging Cultures Group Inc., and RC Stillwell LLC, doing business as Riviera Caterers, for Herc Catering Services at a not-to-exceed amount of $355 million for a contract term of 1 year and 2 6-month renewal options exercisable at the discretion of the system. This was also presented and discussed extensively at the Finance Committee on December 4th, 2023, and approved to bring forward to the full board.
I see you squinting. Would you like me to close the?
Yeah, that might be helpful, actually, if you don't mind. Thank you, Chris.
So on the Herc side here from catering services, we're currently providing we're seeking vendors that would be able to provide 3 culturally competent, nutritious meals per day. The 2 existing vendors, Rethink Food and LIC Com, are who we've been using to date. The historical spend there with LIC Com, we've committed $52.6 million through October and paid out $42.5. With Rethink, committed $31 million and paid out $18.3. These contracts, the meals are on a per person per day basis, and can even be broken down onto a per meal basis. There's no ancillary costs identified on this one, and as always, we're looking to competitively bid, and all expenses would be covered under the MOU with the city. And at this point, actually, we've completed multiple reference checks for Bridging Cultures Group and Stillwell LLC. So Dr. Long can probably speak briefly to some of the successes of our food program.
Yeah, so the food program has been something that we've put a lot of thought into, and I'll start with a quick anecdote, which was initially the vast majority of asylum seekers that were coming into our city in need of help were coming from South America, Venezuela, Colombia, Ecuador. But there was a moment in October of 2022, just weeks after we'd opened the tent-based site at Randall's Island, where we heard that there was about 80 men from Senegal who were going to be coming that needed halal food. At that point, we didn't have halal food. So remember that night, we actually brought a food truck onto Randall's Island to make sure that people would go, that wouldn't have to go a single meal without having the food that was culturally appropriate for them. And then after that, we decided together, wouldn't it just be easier if all of our food is halal? So then, to date, all of our food is halal. But we learned an important lesson, which was, if we put thought into the types of food that people would want, we'd be able to be the most successful in making people feel comfortable and helping them to take the next step forward in their journeys. So then we embarked upon a survey. We had actually people rate all of the individual meals that they were eating at our sites. And miraculously, from Venezuela to the Ukraine to West Africa, everybody disliked the same meal. Roast beef. Nobody likes roast beef across the world.
Yeah.
And everybody likes the same meal. Everybody across the world likes Italian food. So we were able to actually cater our menu to produce a single meal each day that would be something that people literally voted on from across the whole world. And I think it's just a great example of New York City coming together and being really a melting pot that brings people together. Food is a way that we communicate and show compassion. And I think this has been an important way that we've shown compassion to asylum seekers as we help them to complete their journeys. One more quick note I would say, actually, are you going to talk about the consumption?
No, please.
So another thing that we've focused on too is we don't want a single meal to go to waste. So through a lot of hard work with our teams where we've very closely monitored every single meal that people are eating, we have a consumption rate of 95%, which is substantially better than the consumption rate in my home. And that's enabled us to really make sure that shows that people are valuing the food that we're bringing to our sites. And for the 5% on average that's not consumed, we were able to give that to organizations like City Harvest and even Coalition for the Homeless. So we have a very robust food program that we built and put a lot of thought into, again, as a way of showing our New York City compassion and effectiveness.
On the RFP criteria, we're looking at 3 years in business, MWBE targets, and $1 million in annual revenue. You'll see here the substantive criteria as well as the evaluation committee. Overview of procurement. We move forward with the CRC in July through September into October. We worked through the contracting or review process. And then on November 8th, the evaluation committee met and sought to go forward with the top 4 scorers: Rethink LIC, Bridging Cultures, and Riviera Caterers. Vendor performance for Rethink here has been satisfactory. On the next slide as well for LIC Commissary, both of them have been very strong partners over the last year. For the new vendors, Bridging Cultures Group, this is an Arab American woman-owned MWBE vendor. The menu blueprint meets all of the cultural competency and other standards that we're seeking. Riviera Caterers, also an MWBE vendor, experienced in providing meal services to asylum seekers with other city agency partners. Their menu also meets the needs that we were looking for. As always, work is assigned on need, no minimum guarantees to any vendor, and the contract can be sunset in a favorable terms to H&H at any time. For vendor diversity, you see here each of the 4. The breakdown here, the subcontracting plan. We've worked very closely with the procurement team here at Health and Hospitals, and we're proud of the progress that we've been able to make on this RFP in terms of making sure that there's going to be a very strong, diverse set of sub-vendors, subcontractors that are going to be available through the primes in this one. And you see here some of the information around the breakdown. Riviera Caterers, that MWBE subcontracting plan, TBD. All of the progress that we've been making with them so far, we're very optimistic that not just would they be able to meet the goals, but exceed it significantly. So we're very optimistic about the diversity under this contract. So we're seeking approval to enter into the contract with the 4 entities that Frida read earlier, with a not to exceed amount of $355 million, with an NTE based on maximum occupancy of HERC sites with 3 meals a day, utilizing our historical rates. Contract term starting in January for 1 year with 2 6-month renewals, with the MOU, with all expenses covered under the MOU. Thank you.
Any questions from board members? Please.
A couple of questions. Geographically, where will the meals be prepared by the vendors?
Yep. So all of it is within the 5 boroughs. All of them have spaces where they prepare the meals within the 5 boroughs. For the 2 that we've been using so far, the incumbents, most of the production for LIC Commissary is in LIC in Long Island City. And then for Rethink, their model's a little interesting in that they operate, they intentionally, by design, partner with a lot of different restaurants all over the city, so that they're actually sourcing it from many different locations throughout any given week. And that way they're able to sort of spread the love a little bit across a lot of different restaurants and commissary partners that could be able to bring in the food. So they're really all throughout the city.
And Chris, it's a little over $14 for a day's worth of meals, right? And could you just give me a sense of what a breakfast would be, what a lunch would be, what a dinner would be?
Sure, absolutely. So for the breakfast, it can range anything from, French toast, oranges. There's usually a fresh fruit. Hard-boiled eggs are common to be able to get some protein in there. Milk, and there's different milks under the city's food guidelines, whether it's for a child or for an adult. For lunch, it's oftentimes sort of pre-wrapped sandwiches and things like that, so that if somebody wants to grab that lunch in the morning, we make it available oftentimes in the morning for them to be able to grab and go to bring it with them for the day. Other times it's available at lunchtime, but oftentimes it's sort of sandwiches, salads with a protein on it. And then for dinner, Dr. Long was mentioning sort of, there's Italian food, right? There's no more roast beef, but there's a wide variety of rice and beans. It's, a meat, a starch, is typical vegetable, is typically what we're looking like. With most of the vendors, we look to rotate the menu, on a relatively good frequency, every week, every 2 weeks, sort of start shaking it up a little bit and introduce some new meals, or at least change the cycle of them, so it's not every Tuesday is penne night, that you get to move things around a little bit.
So which of the vendors are doing it themselves directly, and which have that model of outsourcing it or partnering with another restaurants or whatever?
So all of them have subcontracting partners. LIC does a lot of the production themselves, but they also have subcontract partners that help to produce the food. Rethink heavily on, they sort of aggregate a variety of different partners. Bridge and Cultures Group, very similar. They're looking to aggregate a smaller number, but aggregate a number of partners that would be able to produce the food under Bridge and Cultures. Riviera, a little more like LIC. They would produce a lot themselves, but they would also rely on some of those subcontracted partners. And that's also how they help to reach some of those diversity targets for MWB Eagles.
And just 2 other quick notes, because we've put a lot of thought into this too. LIC, while they prepare the food themselves, draw almost exclusively from local farms, which supports New Yorkers in New York City and New York State. Acevedo's farm, Maynard Farms, so all farms that are around us here. And the other thing is, we have a lot of children that we serve food to, so we're in very close communication with the Mayor's Office of Food Policy, and all of our meals are strictly adherent to the New York City health standards, which in my mind I just picture, my 2-year-old, my 4-year-old, when I think about the importance of healthy food and making sure they have nutritious meals, and we're always adherent to that.
And the $14 is from creating the food package to delivering it.
That's right. All in $14.40 for 3 meals a day. But we see, lunch consumption might be a little lower during weekdays when a lot of the kids might be at school, and so we lower the orders during lunch during the week, for example. So we wouldn't necessarily pay $14.40 through that day because we're not ordering as many lunches.
Right.
But if you order 3 full meals, it would be up to $14.40, and we're constantly working to bring that down through efficiencies, fewer deliveries, changes in the packaging, things like that. So it's a cap of $14.40, but we actually see a lot of opportunity already under the new contract to be able to bring those prices well below that.
Thank you.
So,
Okay.
so I think this is great, and it's very clear how much thought you guys have put into this, and and with the diverse vendors and the food survey, it's just amazing. I mean, food is really the most important compassionate thing, and being a big foodie myself, that's really great. And so the one thing you didn't touch on the slide of the program improvements, because food waste was really important, getting things that people want to eat, really important, the survey was cost savings. Chris, you started to allude to that, and I think at first blush, we look at it and it seems like it's a big jump, right? Was the prior spend versus now, but that's, and you can correct me if I'm wrong, the cost per day for the contracts, the maximum cost is much lower. The reason the amount is so much higher is solely because of our projections for the NTE. Is that right?
That's right. Yeah, we don't expect to come anywhere close to that NTE if all things are equal. Now, we don't know, part of it is we don't know where the emergency is going to take us or the crisis is going to take us, right? And if we need to open a large number of additional sites, we wanted to have a little bit of buffer in there. But being able to manage well below that, lower lunches, count in that example, increasing efficiency in terms of lowering cost, frequency of deliveries, things along those where we can sort of change some logistics that keep the quality of the food just as high, but we just change things on the back end. That can go a long way in terms of cost savings that bring that $14.40. We're already seeing it below $14 for a number of the vendors going forward. So we're optimistic we're going to be able to help keep pushing that down while maintaining a strong quality.
And just to accentuate that point, because I think, Frida, you're asking a really important question here. We serve 430,000 meals each week across all of our sites. So we have, that's a very large number, which enables us to really negotiate down the price. And through the RFP, the less than $14 that we already have at many of our sites, or that we will have through this process, is dramatically lower than where we were when we started to do this. I want to say we were something like $25 or something like that per diem. So, through this competitive process and through the purchasing power that we've created by having the system as large as it is, we've really been able to dramatically decrease cost.
Okay, Jackie Rowe Adams and Dr. Fisher.
Yes. So at each site, maybe I missed this. Each site, is it wagons? Is it? How do they get the food?
So the LIC commissary, Rethink, the two incumbents, for example, what they would be doing is bringing the food. Sometimes they'll bring it in prepackaged sort of to-go containers that you might get from a restaurant, the small plastic ones like this. But almost always it's actually coming more like a catering style in the large aluminum tins, and then they dish it out as people are coming through the line. That way they get to see the fresh food getting served right in front of them. It's getting hot. That has the added benefit from a food safety standard that it's easier to transport food and keep it warm and hot inside those large metal trays. And so we continue to work with the food vendors to be able to do that. But typically it's that catering style. It's sort of served right in front or sort of prepackaged on site just before somebody comes through the line.
Oh, okay. So they actually have a place to sit down and eat?
At most of the sites. At most
Oh,
of the
so
sites we
this
have
is-
that.
this is
Large
good.
congregate sites, we have some large cafeteria spaces. At many of the hotel sites, we have sort of the hotel's restaurant space where people can sit and eat. But oftentimes people like to take the food and eat out, in a park nearby, bring it up to the room, eat upstairs. So it can be flexible.
And just to add on to what you're saying too, as we serve the food, it's important for people to recognize and be able to understand what the food is. So I want to. We've worked closely with Legal Aid to have each meal with each ingredient labeled in multiple different languages, so that you as an individual can feel confident if you have an allergy or something like that you know exactly what's in each
Right.
meal. And if you do have an allergy or any sort of other need, we make special meals for you.
Thanks. Dr. Fisher?
What about waste stream management, composting, and use of recyclable packaging? Is that all built into the process?
Yeah, increasingly so. Yeah, we've gotten better and better at that over the year. I need to double check. I don't want to overstate, but I know a lot of our packaging, if not all, is certainly recyclable. I want to check about the composting piece. Actually, I can follow up with you on that. But I know if not all, very close to all of our packaging would be recyclable.
Great.
Okay. Okay, I would like to take this to a vote. Then all in favor, please say yes.
Yes.
Opposed, say no. So resolution approved. So last one on this.
Last one. Authorizing the New York City Health and Hospitals Corporation, the system to execute contract with Happy Nest Inc., Sodexo Inc., Sun International Trading LLC, Burn Blue 2081 Flatbush Avenue LLC, doing business as Blue Laundry Services, for Herc Laundry Services at a not to exceed amount of $33,800,000 for a contract term of 1 year and 2 6-month renewal options exercisable at the discretion of the system. This was presented to the Finance Committee also on December 4th, 2023, and approved to bring to the full board.
Thank you. So for this one, for these laundry services, we're currently providing routine laundering services at the sites, typically twice a month. We're seeking vendors to continue providing this, looking here again for competitive bidding. Our two existing contractors, Sodexo and Happy Nest. With Sodexo, we've committed $6.1 million through October and paid out $3.7 million. Happy Nest committed $650,000 and paid out $520,000. Their pricing models are a little bit different, with Sodexo's on a per pound basis and Happy Nest on a per bag basis. That plays to an advantage on big sites versus small sites, which has been good when we're thinking about assigning work between these two partners, that their pricing model actually is favorable to us, even under the current setup. As said, we're looking to competitively bid. We have now completed multiple reference checks for Sun International Trading and Blue Laundry Services, and the expenses are covered under the MOU. Here for RFP criteria, you see 3 years of business, MWBE, and $1 million in annual revenue. You see the substantive criteria as well as the evaluation committee listed here. For procurement, we went forward to the CRC in August, and then through October and into November, we received and reviewed proposals, and we're seeking to move forward with the top 4, Happy Nest, Sodexo, Sun International, and Blue Laundry. Vendor performance for our 2 incumbents, both are marked satisfactory. Here you see Happy Nest. And next, I think we've got Sodexo. Both have been very strong partners with us for the duration of the time we've been working with them. Sun International, one of the new ones here, is an Asian woman-owned MWBE with 10 years of city contract experience, and facilities. There's multiple facilities located throughout the city. For Burn Blue, they're applying for MWBE status themselves, and we're working through their capacity. We believe they might be available to deploy immediately or soon thereafter if we wanted to engage them. As always, the work is based on need. There's no guaranteed minimum, and again, as always, the contracts can be sunset in favorable terms to H&H on short-term notice. For vendor diversity, the vendor diversity team set a goal of 30%. You see here that Happy Nest and Blue Laundry Services both have pathways to get there. Sun International Trading and MWBE themselves has 100%. This notes that Sodexo is at 16%. We've been working with the procurement team here internally to work with Sodexo. I'm happy to report that actually, since we had to submit these documents, we've been able to get Sodexo up to 30%. And you see here some of the breakdown of the partners that they'll be working with. But Sodexo marked as 16. We're now confident they'll be able to hit that 30% target. So we're seeking approval to enter into contract with Happy Nest, Sodexo, Sun International, and Blue Laundry Services for a not to exceed of $33.8 million. That NT is based on maximum occupancy at Herc sites and guests receiving laundering services on a weekly basis, utilizing historical rates, with a contract start date of January, with a 1-year term, 2 6-month renewals, and as with the others, all expenses are covered under the MOU with the mayor's office. Thank you.
Any questions from the board?
This is personal laundry, not just linen service, or?
This is almost exclusively personal linen service, personal laundering. But there are certain sites where we do need to provide linen service. That is baked into the cost here. Some of our congregate sites, Randall's Island, sites like that, where there isn't sort of housekeeping pre-built in, like there might be at a hotel. We need to be able to provide the linen, so this is included there.
Thanks.
Thank you. Okay, so let me take this to a vote then. All in favor, please say yes.
Yes.
Opposed, say no. So resolution approved. Thank you so much.
Thank you.
Thank you for all the work you do, as always. Let me move to number 10 on the agenda, which is authorizing the New York City Health and Hospitals Corporation to execute a contract with VA Global Construction Corp. To undertake a renovation at NYC Health and Hospitals Jacobi Medical Center postpartum department to upgrade and modernize such postpartum department to meet the needs of an expanding community for a contract amount of $12,942,955 with an 18% project contingency of $2,311,732 to bring the total cost not to exceed $15,154,687, and this was presented and approved at the Capital Committee on December 4th, 2023.
Thank you, Mr. Board Chair, Dr. Katz, and the rest of the board. Good afternoon. I'm here today, Oscar Gonzalez, the Senior Assistant Vice President from OFD. I'm here with Chris Mastromanno, CEO of Jacoby, Elaine Barlis, CFO of Jacoby, and my Director of Capital, Hiba Hadid. So we're going to start off with a presentation, talk a little bit about the background, about the postpartum renovation project. Hiba?
Right. Good afternoon, everyone. Jacoby Medical Center currently serves a large number of families where they currently come to us to give birth. Our current postpartum unit is located in Building 1 on the 7 West Wing. We're proposing to renovate both 7 South and 7 West to enlarge the current unit, to enlarge the existing current unit. The current department contains 12 patient rooms that are double occupancy with a shared bathroom. The proposal is to replace it with private rooms and private bathrooms as well. We're looking to upgrade and modernize the entire space. This includes a complete gut renovations of the space of the 2 wings to locate the patient rooms as well as decentralized nurses station for each wing. So the proposal is to do an interior renovation, complete gut renovations of both 7 South and 7 West wings to convert the double occupancy patient rooms into single occupancy rooms, private rooms. We're going to be removing skylight that's located on 7 South to enlarge the room sizes. And we will be creating 2 nurses stations located at each wing to help with the patient experience, better experience. We'll also have a new nursery located on 7 South. We're centralizing the welcome area and reception area. That way it's one centralized area that you come into and you're directed to whichever wing you will be going into. The project is proposed to be done in 2 phases. We will be starting with 7 South, and once it's ready for occupancy, we will be moving to 7 West. We're anticipating to start the construction in spring 2024, and it will end in winter 2025.
Okay.
The next slide has some pictures of what the current status is and the future, what we hope it would look like.
It's going to look like an amazing space. So a little bit about the procurement. We started the procurement in September. 11 contractors showed up and they turned in their bids, all 11, in October. And we found BA Global to be the lowest responsive and responsible bidder. They have met all the full requirements of the contract and the specifications. BA Global is a registered MWBE contractor, so this is a 100% MWBE participation. Contract amount is for $12,842,955. Currently, they are one of our JOCS vendors, job order contracts, and they were also our previous round. And for both contracts, they have rated 84% and 93% in the performance evaluations. And as Hiba said, the work is expected to start this spring, 2024, and complete in winter of 2025. The next slide shows you a copy of the performance evaluations, and based on the questionnaire that was put together, we evaluated them as an excellent. Next slide shows the project budget. So the construction, as I mentioned, $12,842,955. There is a project contingency slightly higher than normal at 18%. Typically, industry standard is 10%, so that's about $2,311,732. The program is going to go into an existing location, an older building that requires a lot of work, and there's a lot of hidden conditions and field conditions such as asbestos and lead, which will be we'll need to quantify and perform. So we have a known unknown that we'll have to work with. So that's why there's going to be a higher level of contingency on this project. And the last slide just shows you the resolution. We'll be happy to take any questions.
So much.
Very quickly, how many patients do you currently have on an annual basis, and how many do you project you'll have with your new facility?
So we're doing approximately 2,000 deliveries a year. With the new facility, we expect to go to a minimum of 3,000.
And
So women's deliveries are our biggest leakage. They leak from us, they go over to Einstein, excuse me, Weiler, where there are private rooms, so they'll seek care with us. They'll deliver another facility and they return back to us. So we track that very, very closely.
and how many beds does Einstein have, do you know?
I don't know.
Okay, that's all right, I was just curious to
not
know
think of that
what the
question.
competition was like. That's all right.
But this will help eat into it. I said, but this will help eat into it.
Oh, absolutely.
At least 1,000.
Right, at
They
least.
have at
it-
least
By a minimum
1,000.
of 1,000.
That's wonderful.
That is wonderful. And also, I love looking at the future state pictures. I feel like I'm in like Star, on a Starship Enterprise or something. It's, and Oscar, just thank you for explaining the contingency, because of course I was gonna ask that. But it makes sense.
Any other questions from board members on this? Okay, so let me take it for a vote. All in favor, please say yes.
Yes.
Opposed, say no. Okay, resolution.
Thank you very much.
Thank you so much. So, Ms. Hernandez Pinheiro, you have the next one?
Oh, yes. I do.
Number 11 on the
Okay.
agenda.
Number 11, authorizing the Executive Director of Metro Plus Health Plan, the plan to negotiate and execute a contract with Accenture LLP to lead the business implementation efforts for the plan's new core processing system for an amount not to exceed $20 million for a total 26-month contract period.
Good afternoon. Talia Schwartz, Presidency of Metro Plus Health Plan.
Good afternoon, Ganesh Ramartan, Chief Information Officer at Metro Health Plan.
Hi, I'm Steve Stein-Cushman, Chief Counsel at MetroPlus.
We'll take us through the presentation.
So thank you for the opportunity to present on the management services consulting contract for our core processing system. To reground the board, you guys approved us to move forward with a core processing system on September 28th. The core processing system is the engine of our organization that contains our membership information, our provider information, our claims payment, information that our customer service center will use in interacting with both our providers and our members, as well as the contract terms. So this is an extremely complex replacement program. So we need to partner with a partner that can help in coordinating all of the activities around this implementation. We are going to be sunsetting an antiquated 30-plus year legacy system. We're going to develop a new data warehouse to house a lot of the information from the system. We have to convert 2 years of claims and medical data to live into the system from the old system. We're going to be touching about 40-plus systems. And at the end of it, we should eliminate about half of that, about 20 of those systems. And we're going to have multiple go lives. So it is an extremely complex program that we need assistance in moving forward. So in this RFP, we have the minimum criteria was the partner must have experience implementing a health edge system, both a system called HRP and guiding care to manage this CM, UM, and DM solution. They must have experience with core administration of Medicaid and Medicare lines of business. They must have experience in organization as large as Metro Plus, and they must have a MWBE plan or utilization plan or a waiver. We took this really seriously in terms of selecting the right vendor. So the evaluation committee consisted of our compliance officer and next level executive. The evaluation criteria is on the right-hand side. For the selection process, we posted an RFP and sent directly to 24 vendors. We held a pre-proposal conference program. 7 vendors responded. We met with all of them and had presentations and demonstrations. Final scoring occurred on December 1st, and Accenture ranked most favorably by the evaluation committee. Accenture does have a 30% MWBE utilization plan. consisting of Raj Technologies and Genesis Consulting Services. What does Accenture bring to the table? They're going to bring to the table some product leads, functional subject matter experts for specific work streams, project managers, change managers, support staff, advisors, data conversion specialists and strategists, and regulatory lead and advisor. They're going to bring with them playbooks for implementation based on their previous experience. So this should go hopefully very smooth for us based on their past experience. They're going to bring planning tools and project management tools. They're going to be responsible for the overall project and program management of this system and other systems that touch Health Edge, including bringing in our business process from our current vendor. They do some claims processing for us. That's going to be brought in-house as well, and they're going to help oversee that aspect of it as well. They're going to stand up a transformation office for all of this. They're going to help in all of the requirements gathering, regulatory support, data conversion, and any migration tasks associated with this endeavor. So we are asking for the board to authorize Metro Plus Health Plan to negotiate and execute a contract with Accenture to lead the business implementation efforts for the plan's new core processing system for an amount not to exceed $20 million for a total of 26-month engagement period. Can you take any questions?
Thank you for your presentation. Great presentation. I wanted to ask you, like, once you have the core processing system designed and I guess laid out and in place, like, what happens, like, after it is set up? You know, like, are there any costs or issues associated with running it, or upkeep or maintenance or anything?
Yeah,
like
so we have license costs with Health Edge that the board approved on the 28th over a 12-year period. There's a 2-year implementation period and then a 10-year production period.
Okay.
So we will have to maintain it, and the Health Edge is responsible for supporting that effort.
Thank you. That's what I wanted to know. Thanks. Anything else on this one? Okay, so all in favor, please say yes.
Yes.
Opposed, say no. So the resolution approved. Thank you so much.
Thank you.
And we have one more. Sally?
This is what stands between us and freedom. Okay. Authorizing the executive director of Metro Plus Health to increase the funding by $15 million for its previously executed agreements with Prager Creative LLC and Bellwether LLC, and to allocate these additional funds for media buying, creative advertising, and marketing, digital content and social media, and public relations services to these two contracts for a total amount not to exceed $35 million for a total 5-year term.
We're joined by my colleague.
I'm Laura Santella-Saccone, the new marketing and brand officer for Metro Plus Health. And I'm coming to you today to talk a little bit about our advertising contracts and where we would like them to evolve. A little bit of background. The Metro Plus Health advertising plan requires our advertising vendors to provide an array of services. They range from media buying to creative services, television and video marketing, production, market research. Our contracts are with Prager Creative, Bellwether, and Milton Samuels Advertising. They were procured by RFP in 2021 for a cumulative $20 million for a total of 5 years for all 3 vendors. That was approved by the MPH board in July of 2021. The contracts are set to expire August of 2026. Today, we're here to ask for an increase in the cumulative spending authority of those contracts to $35 million. This was also presented to the MPH Board of Directors for approval on Thursday, December 7th. I want to share a little bit about our evolution because I think this is very, very impressive. The MPH brand underwent a remarkable transformation in only a 12-month period, something I have never seen in my career. Incredibly impressive. Transitioning from fragmented identity to unifying and modernizing the brand to what I say is ultimately culminating in one of the most successful brand relaunches in a very short period of time, only 12 months. And our investment, as we can see, has had a positive impact on the brand in our community, as evidenced through the heightened awareness we've delivered, increased consideration, website and call traffic. 6 out of 10 New Yorkers are aware of our brand after only 12 months of brand relaunch, and we've had over 1 million new visitors come to our website. Just a handful of phenomenal metrics that demonstrate we've driven successful demand. So as we think about the next generation of driving demand, what we understand is that there is, if we could go to the next slide, please, that there is a current gap in tracking driving demand, generating consideration, and then converting the member. So our Metro Plus Health marketing department is going to evolve over the next several months to focus on what we call marketing attribution, being able to link that demand to consideration to enrollment, ultimately with the intent of understanding what channels are driving performance and what ROI are we generating from those channels. Marketing attribution is a journey, so we're looking forward to finally be able to connect the dots. And we're starting to do that already with digital. Digital is the easiest place to start attribution because you have the power of Google Analytics that allows you to track things such as clicks. Again, we will start with the digital journey and then transition to all other forms of media. Next slide, please. So I talked about the not to exceed from 20 million to 35 million. So what makes up that 15 million? There's $3 million that accounts for inflation. Media, like every other category, is impacted by where the economy is going, unfortunately. This factors in about a 15% increase in media. I will say our agencies are phenomenal at driving very effective, low and negotiated media buying rates. 3 million incremental will be to account for the competitive landscape that we're dealing with. New York is a very densely populated city where health insurance competitiveness is significant. So in order to be able to really compete with the big players who are outspending us, we need to do some smart, as I call it, investment spending. Our competitors outspend us 4-to-1 in traditional, 25-to-1 in digital media. So it's important that we be able to play in that space as smart and as competitively as we can. The remaining 9 million of the 15 million is simply a reallocation from some fragmented small vendors to the retained main vendors that are really driving the bulk of the creative work that's delivering results. It's important because we want to drive efficiencies, we want to capitalize on economies of scale, and we want to continue to tap into the agencies that are really helping to deliver outstanding results for us and take it to the next level. So our request is original approval of 20 million. We are asking to increase that not to exceed by 15 million over the remaining 3 years. Again, 9 million is a reallocation and 6 million is an actual increase to the budget, 3 million inflation, 3 million investment spending.
Thank you so much. Any questions from board members? Yes.
I'm sorry, I'm maybe didn't hear. What is the 9 million real? Can you explain that? I think
Yes.
it sounded like it was a good outcome, right?
Yes, it is. It's shifting the dollars in the budget from a group of smaller vendors who are all managing aspects of advertising to the core agencies that will drive the bulk of the work that we're doing, simply because they're larger, they're much more efficient in media buying, and they have the expertise to help drive those efficiencies and economies of scale. We will continue to work with the smaller vendors. They will serve a purpose in helping us to do things that are much more specialized, like buying media in specific languages such as Chinese or Hispanic. But the larger agencies, it's a reallocation of dollars to them so that they can carry the bulk of the activities for us that are driving such success for the brand.
We're already spending the $9 million today. We just want to put the $9 million under this contract.
I see.
Yes.
And then I know you talked about the success of the brand awareness, and I see it myself. Just
Wonderful.
The unification of the brand. A lot of the metrics, kind of that I think you're talking about here, are about visiting the sites, click, and is there a way to track actually sort of penetration, conversion into members and things? And is that
Yes,
I'm not
that's
sure what also our consideration has increased by 17% means, so.
right. So yes, the plan is to apply attribution methodology to driving conversion beyond digital and being able to do it for radio and print. Attribution modeling is a journey. It takes a lot of steps. It takes technology, call disposition, evaluation of data. There are many different steps to applying that, and our goal is to start to apply that specifically beyond digital. And so we will see over the next several weeks and months how we evolve and apply that thinking of attribution modeling so that we can actually understand how many leads we're driving, are they quality leads, are we converting those leads, and what is the cost per acquisition, and ultimately what is the ROI, so that we then know if we have a pool of money, we know which lever we want to pull effectively so we can be efficient. Does that answer your question?
We have proxies right now.
Yeah.
And the proxies are how many people are aware of Metro Plus? 62%. How many people are then considering us as an option for their health coverage? That's the increase that we saw. Considering meaning not necessarily becoming a member, but considering us as one of the options. So we saw a huge increase there. We're missing the last leg of this, which is, okay, they considered us based on each of the marketing campaigns that we do. How many became a member? We're still working on this last leg. What we can share is our membership grew and our market share in some of the lines of businesses increased. So obviously it's not just that, it's everything that we're doing, but we have some objective metrics to show that what we're doing is working.
And you hope to have more, is what I'm hearing you say.
Absolutely.
Right.
We will always have a combination of affinity metrics, which are awareness, consideration, intent, and then the hardcore metrics, which are, number of people that came to our site, number of people that clicked, number of people that converted. So we have to have a balance of the two metrics. We've been leaning more towards the affinity. With attribution modeling, we will have some more of those hardcore fact-based metrics to balance that out.
Great. Love to, maybe in a year or so, get an update on that. It'd be
Absolutely, would love to do that, absolutely.
Thank you.
Just want to say these are important investments, and the one that comes to mind besides just getting people to pick one plan is the fact that in this line of business you are also helping folks join a plan that may not have it otherwise, or become aware of that. Which I don't know if you can untangle the two, but it's something that I think is different from other markets. So these type of investments are important.
Yes, we agree that marketing is a combination of driving demand, but what we really want to do and invest in is brand retention. If we can drive brand retention, have people stay with our brand longer because we deliver outstanding benefits and great customer service, we drive loyalty, and loyalty drives brand ambassadors. So our goal is with that investment spending to really focus on brand retention.
Thank you.
But Jose, is what you were saying that we should be tracking folks who had never had health insurance before?
Yeah, I mean, it sounds complicated to us, so I'm not trying to sort that out, but it's something that
Yes.
crossed my mind as I was listening to
Yeah.
you.
And we do have the capabilities to look at the size of the market, so the size of the addressable market, the people that we already have within the plan and the people that we don't, and we're able to do that by zip code, ethnography, so to understand the size of the addressable market, and then how from a tactical standpoint we can engage with them. So that level of assessment is happening as we plan for 2024.
But can we also track the people that have never had health insurance before and
No.
we can't do that?
No.
The reason is, if they were employed previously and had their coverage through an employer, we would know that.
But I do think that there's these benefits that are very intangible.
That's right.
Yes,
But
that is correct.
That's one, and the one you mentioned, are like somebody that has continuity with one health plan. It means continuity with the provider and all of that, and that's all
Absolutely.
positive, I
The
think.
last thing you want to do is constantly change your health
Yeah,
plan.
yeah.
It's a lot of work. So we want to make it as easy for you as possible and have you be as loyal as can be.
Thank you. Okay.
I wanted to mention it's completely anecdotal and it's broader than this, but I've noticed people view Metro Plus Health differently
They do.
than they did 6 years ago. And I don't think it's any one thing. I think it's the leadership team of Metro Plus Health. I think it's the board's involvement, and Sally's puts a lot of time into the board for Metro Plus Health. It's how Health and Hospitals has become a better provider, a more responsive provider, appointments sooner, and it is the marketing, because one of the most helpful conversations that I remember having with Talia early on as a provider was saying, hey, Talia, how come Health First provides all these benefits and we don't? And what she promptly told me is, oh, we do. It was an issue of perception. It wasn't true. But they had done, and we're a member of Health First. It's not negative. It's just to say they did a much better job of marketing what they had, and we were providing the same thing, but nobody knew we were. So it's as if we, in terms of gaining new members, it was the same as if we weren't doing it, because nobody had any idea that we were doing it. So I think that things have really changed. And again, this is one important part of it, but there's a good story to tell, and you can tell part of it by the general growth of membership, although that's also determined by other things. But how providers think about it, what providers are recommending to their patients, what patients say. I had a patient who was uninsured working, who said, I heard that Metro Plus Health was a really good plan to choose if you're going to use Health and Hospitals, which I, of course, affirmed was an excellent choice on his part. So I want to congratulate you and, again, appreciate the time Sally spends on behalf of all of us on the board to strengthen the health plan.
Okay, so let me take this to a vote then. All in favor, please say yes.
Yes.
Opposed, say no. Thank you so much, and enjoy the holidays. So let me move on. Two more things. Vendex approval, since we began the process, well, no, we have your report too. Since we began the process of approving contracts prior to Vendex approvals, there are 18 items on today's agenda requiring Vendex approval. 12 have that approval. There are 4 items from previous board meetings pending Vendex approval. Since we last met, 2 approvals were received. We will continue to notify the board as outstanding Vendex approvals are received. We now have the President's report, Dr. Katz.
Okay, very good. Well, we want to mention that our facilities all take the holiday season seriously as an opportunity to celebrate with our patients. And of course, it's a multicultural celebration and a lot of effort put into things like toy drive for our kids. I don't need to say much more about how we respond to the humanitarian crisis of services for asylum seekers. You heard a long presentation, but in case you missed the number, our arrival center has registered now 85,000 asylum seekers. So it's an extraordinary amount of work, remembering that even if we're not housing, feeding, doing laundry in the case management, we're immunizing, signing people up for insurance, registering kids for school, the whole set of important activities. We had our public hearing last night for Just Home. I want to thank our board chair, Jose, and Frida and Sally for being there. A lot of people came forward to talk about the program. This is a supportive housing program for people with health issues such as congestive heart failure, stage 4 cancer, end-stage renal disease, who cannot be placed in the city's homeless shelters because they need services the shelters were not designed to provide. There's nothing negative about the shelters. Many of these people need their own bathroom because of side effects due to chemotherapy, or they need help with the activities of daily living. And we believe that this will be a good facility for them. The community got to hear about, I thought one of the most important parts of the presentation was Fortune Society talking about Castle Gardens residents. This is not the first residence. And as they pointed out, the neighbors who were not necessarily enthusiastic about it before it opened now view it as a positive part of the community. And it is natural, and we certainly heard people's fears. But I believe that someday this site will open and people will feel that they are good neighbors, they are doing a useful service, and a lot of people will get care and housing that they really need. Gotham Health Morrisania was recognized for the Million Hearts Hypertension Champion. Healthcare access webinars were hosted by NYC Health and Hospitals, the Mayor's Public Engagement Unit, New York State of Health, HRSA, and the New York City Department of Health and Mental Hygiene. We got Plaintree International recognized 3 additional New York City Health and Hospital locations for their commitment to enhancing the staff, patient, and family experience in healthcare facilities. We are on this journey with Plaintree for many of our facilities. We opened up 2 new murals as part of the Arts and Medicine department. They've been very successful. One was at Carter and one was at Morrisania. We also had a beautiful ceremony, and I know it was videotaped, so if you didn't get to go, there was, I found it incredibly inspiring. What Woodhall did is they took a hall that had a phenomenal Keith Haring mural. Then they took some of the art from our historic collection that matched in theme and technique the art being done by people at Rikers. And so you got to see sort of the historic art of health and hospitals and how art was being used as a therapeutic medium at Rikers, and many testimonials about how important art is as a way of expression, a way to deal with frustration. Art also, I know the mayor talks all the time about how many people at Rikers have learning disabilities. And art is, because it's an alternative form of communication, it doesn't necessarily track with a learning disability. So you might have a learning disability that will mean you'll never be a great student of books, but you might be a phenomenal student of art. And it was an incredibly inspiring event that we hope to be able to have in the future. We had a number of leaders at Health and Hospitals and Metro Plus Health recognized as, power players. We were very proud that the CEO of Community Care, Nicole Jordan Martin, received the 2023 Empire Whole Health Heroes Award. We are working with the city, state, and federal governments on issues that we have raised before here. I will not go through it, and I want to be able to read, for the sake of the record, our emergency contracts. The first of these concerns our rental of space on Hall Street in Brooklyn that I approved on June 27, 2023, with a ceiling of $22,070,003 for construction and $22,162,590 for rent and other occupancy costs. As the city's need for additional space for migrant asylum seekers grew, we exercised our option to almost double the footprint of the project. The projected operating costs will correspondingly increase, as will the construction costs to prepare the space for asylum seekers. With these increases, the total construction costs for improvements of Hall Street are projected at $53,384,294, and the total 18-month projected operating costs will be $41,859,013. We have also allowed for an additional $15 million to pay for the alterations to a previously renovated part of the property. While nothing is planned or approved yet, there may be a future decision to alter part of the property to be suitable for a different service delivery model. This would involve putting up partial walls to make separate pods for each family unit. The work and the associated expenditure will be made only with further explicit approval by OMB. The second modification to a previous exception made May 31st, 2023 concerns the property we leased at 320 West 31st Street in Manhattan. There we have had to reimburse unexpectedly high insurance costs, but that increase is partially offset by terminating the agreement 5 months early after only 5 months of operation. The net effect of these developments is a net increase of $22,714 to bring the total to $8,236,414. I also recently approved an exception to policy to permit a 6-month continuation of 21 CBO agreements, which were procured through an RFP process. The initial term of the agreement was February 22 through October 2023, with the budget of $4.93 million. The additional amount is not to exceed $1.1 million. These contracts support education outreach in New York City enrollment assistance. An RFP is being conducted that will replace these contracts prior to their expiration. It's hard to believe we're through another year. It was a year where a lot of good things happened at Health and Hospitals, some not so great things in the world, but it's nice to have our little microcosm where no matter, what difficult things are happening in the world, we're able to make small improvements in our New York City world for people who really need us. And I hope you all go to bed, as I do, proud of your efforts and what your efforts mean. We could not run Health and Hospitals without our, to remind everyone, entirely volunteer board. And we appreciate the commitment of time and effort and all the ways you make things better for our clients. So I wish you all happy holidays and happy New Year. And we have a lot more work to do next year.
Yes. And in February, I'll be on the board a year. Wow.
Oh, we're gonna have to have a big cake
Have a 1-year party, Jay.
1-year party.
Oh,
Yeah.
our
Any
chair
questions
would
for
like
you?
us to get back to business.
Yeah. Any questions for Dr. Katz? Okay. So the committee and subsidiary reports were emailed to you and are in your folders for your review and submission into the record. Is there any old or new business to come before this board? Hearing none, the board meeting is adjourned. Thank you.
This meeting is no longer being recorded.